Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. Figures from the Health Protection Surveillance Center have shown that 18 sexually transmitted infections were diagnosed in the 0 to 14 age cohorts between January and early August in 2021. Similarly, there were 498 cases of HIV and STIs reported in the 15 to 19 age group over the same period. According to the figure, a total of 6,256 cases of HIV and STIs have been recorded this year. The 20 to 24 age cohorts reported the highest number of infections, with 1,896, followed by the 25 to 29 group, with 1,387, and 30 to 34-year-olds, 1,055. Chlamydia is the most commonly reported STI, followed by gonorrhea and genital herpes. And despite sharp fall in fresh COVID-19 cases, Karnataka continues to register several post-COVID mucormycosis cases from July 22nd to August 7. There have been 156 additional cases and 59 additional deaths. Official data shows that on August 7, Karnataka had 3,718 cases in total, out of which 51.5% of cases were still under treatment and 9.89%, or 368 people, had recently died of the complication, which causes necrosis of tissue. It was gathered that about 334 people who suffered from the complication left treatment against medical advice. The Nigeria Center for Disease Control says it has confirmed 37,819 new cases of cholera disease, with 1,178 deaths registered in 23 states of the Federation and the Federal Capital Territory, Abuja, as at August 14, 2021. The NCDC Director General Chikwe Ihekweazu made the disclosure in an interview with newsmen in Abuja on Monday. Ihekweazu listed the affected states to include Benue, Delta, Zamfara, Gombe, Bayelsa, Kogi, and Sokoto. Others are Bauchi, Kano, Kaduna, Plateau, Kebbi, Cross River, Niger, Nasarawa, Jigawa, Yobe, Kwara, Enugu, Adamawa, Katsina, Borno, Taraba, and the FCT. Ihekweazu said out of the reported cases, 26% were aged 5 to 14 years, and 51% were males and 49% were females. Bauchi reported 773 cases, Niger 284, Zamfara 253, and Katsina 217, account for 78.1% of 1,956 cases reported in the last 2 weeks. And a gene called PFAP2HS, which allows the malaria parasite to defend itself from adverse conditions in the host, including febrile temperatures, according to a new study led by the Barcelona Institute for Global Health, has been discovered. The study, which was published in Nature Microbiology, resolves a long-standing question on how the parasite responds to changes in its environment. Infection by Plasmodium falciparum, which causes one of the most severe forms of malaria in humans, is characterized by periodic fevers. In this study, Curtis and his team set out to investigate how the malaria parasite regulates its response to higher temperatures or heat shock, despite the absence of HSF1. They observed that a P. falciparum cell line grown in the laboratory had lost its capacity to survive when exposed to a temperature of 41.5 degrees Celsius, and that this was due to a mutation in a gene which they named PFAP2HS. They showed that PFAP2HS acts as a transcription factor that activates the expression of heat shock proteins HSP70-1 and HSP90 by binding to their respective promoters. They also show that engineered parasites lacking the PFAP2HS gene not only had a lower survival when exposed to higher temperatures, but also showed reduced growth at normal temperatures of 37 degrees Celsius. And the Federal Ministry of Health has confirmed again that the incidence and death in malaria fever is on the increase. The fresh insight by the Minister of Health, Osagie Ehanire, during a courtesy visit to the Ogun State Deputy Governor Nelmot Salaku Oyedele to seek the state's support for the fight against malaria, disclosed that at least 9 persons die of malaria every hour in the country. The announcement, according to experts, depicts the sorry state the disease has put Nigeria in and should push the government to devise effective containment and eradication strategies. This is TOS Television Network and you are watching Health 54. Do stay tuned.
There are certain moments in the day when I need my me time to just unwind and indulge.
What is this?
The Cadbury goodness is in every pack of Cadbury 3-in-1 hot chocolate, making you feel cheerful and pleasant.
Now available in 30 grams and 450 grams.
Thank you for staying with us. This is Health 54. Nigeria's former president, Chief Olusegun Obasanjo, on Wednesday during the closing ceremony of the Ogun State Diabetes Youth Development Camp held in Abeokuta, narrated how he has been managing diabetes for the past 35 years. According to the elder statesman, many of his friends have died of diabetes because they were unable to manage the disease. Obasanjo, while advising the young patients, maintained that diabetes is not a killer disease. According to him, he went around with his drugs and testing kits to ensure he has the right blood sugar level. He stressed that he was above 80 years and could engage in every activity despite being diabetic. The former president, however, told the young patients to follow prescriptions given to them in managing the disease. A new Phase 1 clinical study for the first time has shown how treatment with a type of stem cell called mesenchymal stromal cells is able to regulate important factors driving inflammation in patients with chronic obstructive pulmonary disease for a period of time. The study, whose results were released in Stem Cells Translational Medicine, provides insights that may aid in developing a new cellular therapy for treating COPD, which is among the top 5 causes of morbidity and mortality worldwide. Obstructive pulmonary disease is a chronic inflammatory lung condition that obstructs airflow from the lungs. It is generally caused by long-term exposure to irritating gases or particulate matter. Most often cigarette smoke. Symptoms include difficulty in breathing, chronic cough, lack of energy, wheezing, and frequent respiratory infections. People with COPD are also at an increased risk of developing other serious diseases such as heart disease and lung cancer. The Lagos State Commissioner for Health, Professor Akin Abayomi, said the state recorded 393 new COVID-19 infections out of the 2,720 tests conducted on Tuesday, bringing the state's total infections to 69,145. Abayomi said he made this known via his Facebook account at Professor Akinola Abayomi on Wednesday while giving the state's COVID-19 update for Tuesday. According to the Commissioner for Health, 9 persons died from COVID-19 related complications in the state on August 17, increasing the state fatality figure from the virus to 481. The Commissioner also said 4,286 persons with active COVID-19 cases were receiving treatment under the state's home-based care. He added that 222 COVID-19 infected patients were being managed at the state's isolation centers. According to him, 59,382 of the infected persons had so far recovered in communities, while 4,653 recovered in the state's COVID-19 isolation centers. The commissioner added that the total of COVID-19 tests conducted in the state since the outbreak of the pandemic stood at 651,000. Ghaziabad, under its new check-up plan, disclosed that the health department team will go to all government offices and conduct tests for the most common ailments such as hypertension and blood sugar, adding that early diagnosis will enhance better treatment. According to the health department, the teams have so far screened around 1,000 employees by setting up camps in the municipal corporation, Ghaziabad. Development Authority, Health Department and CBI District Surveillance Officer Dr. Rakesh Gupta said doctors are carrying out the drive twice a week. According to Gupta, so far 4 departments have been visited and about 10% to 20% of the staff has been found to be suffering from hypertension and blood sugar at each office. They have been given medical consultation. The aim of the program is to diagnose the disease at an early stage and provide help. Gupta, who is also the nodal officer for the Prevention of Non-Communicable Diseases program, stated. And before we go, the United Kingdom government on Tuesday made a donation of 699,760 doses of the AstraZeneca COVID-19 vaccine to the federal government of Nigeria. The Executive Director of the National Primary Health Care Development Agency, Dr. Faiza Shaib, during the inspection of the vaccines at the National Strategic Store in Abuja, expressed gratitude to the government and people of the United Kingdom for the kind gesture. He stated that the additional AstraZeneca vaccine would be deployed immediately to the states to be administered as a second dose to those who had earlier received only the first dose of the vaccine during the first phase of the vaccination rollout. He also directed all those who have received AstraZeneca as first dose to visit the nearest vaccination site to receive the second dose in order to have full protection against COVID-19. Shaib hinted that at the end of August, the agency is expecting another additional 801,600 doses of AstraZeneca vaccines from the COVAX facility donated by the Canadian government. And that is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. And do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube to stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.